Hello, I am Dr. Glennah Trochet. I work with the Public Health Department of Nevada County. Today we are going to talk about laboratory tests to see if someone has the new illness called COVID-19. But first we will have to talk about the virus and how our bodies defend themselves against it. The cause of this illness is a virus of the coronavirus family. It was not known in the world until the end of last year when it appeared in the city of Wuhan in China. This coronavirus causes an illness that starts with a cough, malaise, fever, and can cause pneumonia and even death in some people. Most persons get better without problems. Those who have the higher risk of severe illness are people who are 65 years or older and people of any age who have a chronic illness, such as illnesses of the heart, lungs, or immune system, such as diabetes. In the case of this coronavirus, the germ enters our body through the nose, mouth, or eyes. It invades our cells and starts to multiply. The cells transmit signals to white blood cells in the bloodstream, also known as lymphocytes, that circulate in our system, destroying microbes that can make us sick. These lymphocytes produce an alert signal to our body, and during the days that we are sick, our bodies are fighting and destroying the virus, creating substances called antibodies. These antibodies stay in our body, and if the virus returns, they fight the virus right away. And in most cases, we do not get sick a second time. In the case of this coronavirus, we don't know yet how long the antibodies that provide immunity last. To diagnose the coronavirus, they take a sample using a cotton-tip stick that is placed in the nose or the throat. They then put the sample in a machine that tells us if there are viral particles in the sample. Sometimes the sample does not have enough viral particles, even though the person is sick. This is why it is possible to have a negative result, even though the person does have COVID-19. There is another laboratory test that can tell if someone was sick with the new coronavirus and is now well again. This is a blood test to look for antibodies against the coronavirus. Right now, we don't have this test available in Nevada County, but we hope to have it in the future. Unfortunately, we don't know exactly when it will become available. With this test, we would be able to know how many people that live here already got sick and have recovered. That will help us decide when we can open businesses and schools again. Scientific research tells us that the incubation period of this illness has an average of 5 days, but it can take up to 2 weeks before symptoms appear. Therefore, if you are in contact with someone who's sick with COVID-19, they may ask you to be in a 2-week quarantine. People with COVID-19 must be isolated for the duration of the illness and until they haven't had a fever for 3 days without taking any medicine for fever. If a person has a light infection, the illness could last only a day or 2. However, isolation should last at least a week and could last longer if the illness lasts longer. This virus is so new that we still don't know how long immunity lasts against it, and if someone can get sick with it a second time. With other viruses in this family of coronaviruses, it is possible to get sick with them again after a few months or years. We've been asked if this pandemic started in October of last year. Although it is possible that the virus was circulating in Wuhan for some time before they recognized it, the first news of this illness began in December of last year, when there were a few severely ill people and deaths due to the virus. We don't know when they will find a cure for this illness. There are several research projects going on to find out what medicine helps people get better, but there is still no medicine that is recommended to cure COVID-19. Thank you for your attention.